Today, our journey begins in Los Angeles, California. It's pay day for a woman we call Elena. Before she gets home, she needs groceries. Her gas tank is nearly empty and bills are due. And there's a prescription waiting at the pharmacy with her name on it. Elena has health coverage, but tonight, having health coverage isn't quite the same thing as being able to afford health care. She looks at what's left in her account and asks, can this prescription wait until next payday? Because, the way my bank account is set up right now. Welcome back, Pathfinders and Navigators, to another chapter of Pathway to Wellness Navigating Our Journey. Today, we're putting the questions being asked in households across America through a Project Map lens. What happens when healthcare becomes something we know we need but struggle to afford? Well, let's look at the observed. Elena, our representative in this case study today, a 2026 California Healthcare Foundation survey found that 59% of Californians said, like Elena, they or a family member had skipped or delayed healthcare because of costs during the previous year. And among those who delayed care, 42% said their condition or a family member's condition became worse. Take a look at the screen. This information is provided by the California Care Foundation for 2026. That's where affordability becomes more than an economical issue, it becomes a public health issue. Hence, why you're listening to me right now. Let's look at the understand. It doesn't always begin with an enormous hospital bill. Sometimes it looks like Elena, an appointment postponed, a prescription that's been stretched, dental care that's delayed, a test that can't and will not wait, but might have to wait just a little longer, or someone deciding they'll seek care only if things get worse. We have people in our family like that, right? There's always someone who's just gonna wait a little bit longer. Because why? Groceries, gas, bills, and health care. One wallet, multiple needs. And according to a national evidence, the latest West Health Gallup Healthcare Affordability Index found that the share of American adults considered cost secure fell from 61% in 2022 to 49% in 2025. That's the cost secured, like they didn't feel very secure, right, of paying for affordable health care. Look at the direction. Fewer than half were considered consistently able to afford quality health care and needed care and medicine. That's not simply a healthcare statistic, that's a quality of life warning. Now, let's look a little bit more as we widen our lens, right? Because why? We are navigators. So let's widen these lens. If we sat with families in different countries and asked, what makes staying healthy difficult for you? We wouldn't necessarily hear Elena's answer. In some health systems, paying directly for routine care may play a smaller role. The concern might instead be reaching a specialist or finding services in a rural community, maybe waiting for care or having enough healthcare workers that are available in that region. Global health doesn't ask for us to assume everyone has a problem. It kind of asks more what matters to the people who live here, right? And sometimes understanding another community helps us see our systems more clearly. Take a look at the visual. Now, it's time to look at the evaluation, right? We're going to kind of look a little bit more and ask the question, why does this matter now? Well, so as we always like to take you on journeys, now let's come back home because there's another reason Americans should understand their healthcare pathways today. Because did you know, beginning in 2027, new federal requirements will change aspects of Medicaid eligibility and enrollment for some adults? And did you know that here in California, some Medi-Cal members and affected eligibility groups will face new work or community engagement requirements and more frequent eligibility reviews? That's coming in 2027. These changes will not apply to everyone. There are exemptions that exist. That's precisely why knowing what actually applies to you does matter. Take a look at the graphic. It's important that we know how the rules are changing and for who. Don't assume, don't ignore, verify if it applies to you. This isn't about politics. It's about preventing confusion about coverage from becoming another reason someone postponed health care. So let's not get that twisted. We're not talking about politics, although politics and health do collide. But what we're talking about right now is totally different. So when we look at how we can empower Elena, we go back to the pharmacy. Okay? Her prescription still needs to be filled. Understanding the healthcare system doesn't magically create more money for her. But before she simply walks away, there are questions that she can ask. Like, is there a lower cost medication option, like a generic? Does the pharmacy or manufacturer have an assistance program? Could a community health center provide affordable care? Does the hospital or the healthcare system offer financial assistance and scholarships? The important step is asking before assuming there is no pathway. Now, with all these things in mind that I just said that Elena can do to empower herself, is the same kind of things that we need to look at for our ProMap Action Challenge or call to action for this week. Here is the checklist. Pathfinders and navigators, we don't wait until we're sick to figure out how healthcare works. We want to know a few things. We want to know our health coverage. We want to know when it renews. We want to open and respond to coverage notices. We want to find the nearest community health center. We want to know where to ask about prescriptions and financial assistance. And if coverage rules change, verifying whether they actually apply to me. And if cost is causing you to postpone care, tell your healthcare team. Give them the opportunity to help you identify another pathway. Most of them are good at doing just that. So, we started out today in Los Angeles with Elena standing at the pharmacy counter. But her question reaches far beyond that counter. Can I afford to stay healthy? Public health asks what happens when thousands or millions of people begin asking that same question. Global health reminds us that communities around the world experience access, but they experience it differently. And that when we can learn by understanding what matters to them, then, well, we're doing good, right? And the Project Map lens reminds us that understanding the system gives us a better chance of navigating it because healthcare access ultimately affects something much larger than a medical bill. It affects quality of life. So, guys, ladies, students, professional healthcare workers, and all, thank you for joining me for another chapter of Pathway to Wellness, navigating our journey using the Project Map lens. So, remember, keep asking questions, keep keep examining the evidence, and keep making informed decisions for yourself and the people you love. And until next time, to who's ever listening, see clearly and navigate wisely. Take care and caring for you. Oh, yeah, and don't forget to get your guides. It will be on our website under Wings of Hope Charity Store. Okay, and don't forget to like and subscribe and share, discuss, and well, take care. Okay, bye.